The Ontario government will not be dropping proof of vaccination in January as planned, and it's going to make it harder for anyone to fake their paperwork. You are going to have to show your QR code. And this is why cases in the province jumping once again today. In fact, it's been more than half a year since Ontario has reported numbers like these. Ontario today reporting 1,290 new cases and 10 more deaths. That is the highest daily count since late May. The 7-day rolling average now sits at 1,054, which is up more than 200 from 1 week ago. Those who are not fully vaccinated make up about 46% of cases. Some small positive news in this: hospital numbers this time round are down significantly compared to 6 months ago, with 309 people in hospital compared to about 1,000 people in May. So, the highest daily COVID count in 6.5 months and the highest number of cases in schools ever. Those numbers are causing increased concern. The science table is now recommending more testing for elementary students, while politicians and experts call for free rapid tests for everyone.
Despite what the minister, the premier, and their offices say, the rats still aren't free.
Why won't the Premier listen to the medical experts calling for more widespread rapid tests and make them freely available across Ontario before the holidays?
Again, Mr. Speaker, I'm just going to repeat the numbers until it sinks in. 34 million tests. That's more than every single province and territory combined. We're distributing more than 60% of all the tests in the country.
Today, Ontario's Science Advisory Table recommended weekly voluntary rapid tests in elementary schools and workplaces in areas that have 35 cases per 100,000 people. That's much of the province. If cases continue to climb, the table says screening should be done 2 or 3 times a week in those regions.
It is important. It's absolutely vital. And I think that the tide is changing globally. It's not just here in Ontario, it's across the country and internationally that rapid test time have come.
However, epidemiologist Colin Furness doesn't believe the science table's recommendation goes far enough.
Should everyone have access to a free rapid test whenever they want?
Yes, they should. And we have a template for this. The province of Nova Scotia does this. They hand out rapid tests like they hand out condoms. That is to say, for public good, for public safety. And their messaging is literally, hey, if you're going out in the town on a Friday night, have a rapid test first.
Currently, if you're asymptomatic, rapid tests cost $40 at Shoppers Drug Mart. The pandemic has hit low-income and marginalized communities the hardest, the very people that can least afford to pay for them.
COVID is already a great magnifier of social inequity and economic inequity. These sorts of policies make it worse.
Now back to the breaking news I was just telling you about. The province will announce tomorrow it is not going to drop proof of vaccination by mid-January as it had initially targeted. And everyone will need to show their QR code either on their phone or a paper version in a bid to eliminate forgeries.